Hello, everyone, and thank you for joining us this evening for the seventh week of the RISE Institute and Rugby Research and Injury Prevention Group 2026 Sports Science Series. We will begin our first science presentation. Our first intern is Chris from New York. Chris will be presenting on warm-up stretching for soccer players with stiff hamstrings. Chris, may you please share your screen?
Hello, Alon. Thank you for the introduction. Again, my name is Chris Franchini. I'm a rising senior at Northwestern University, and today I will be presenting on warm-up hamstrings and stiffness, and I will share my screen right now. Can everyone see that? Great. So today I'll be talking about warm-up and hamstring stiffness, stress relaxation, flexibility, and knee proprioception in young soccer players, written by Satkinskine and others in the Journal of Athletic Training. So, hamstring strains are one of the most common soccer injuries, and despite lots of research, the exact risk factors are still debated. One thing we know for sure is that greater flexibility lowers strain risk during kicking, especially in the follow-through where the muscle tendon unit and sciatic nerve are the most stretched. Warm-up routines often involve foam rolling or neurodynamic nerve gliding to boost range of motion, but good head-to-head evidence comparing them was lacking. So this study served to um, have that head-to-head evidence and compare foam rolling and neurodynamic nerve gliding on stiffness, viscoelasticity, flexibility, and proprioception. So, as for the study design and methods, this was a crossover design, which is nice because each athlete acts as their own control, reducing individual variability. It consisted of 15 male soccer players on the same team, tested twice 2 weeks apart, once for foam rolling, once for neurodynamic nerve gliding, and the order was randomized. So the same dose was used for both techniques with 6 sets of 45 seconds with 15-second rest, keeping the comparison fair. They measured a lot of biomechanical measures for the outcome. Um, at 2 points in the range, a stress relaxation test, knee range of motion, um, straight leg raise angle, and joint position sense, yeah, walking through each of these to measure. And the measures were taken pre and immediately post intervention using the isokinetic dynamometer. The foam rolling, for the foam rolling case, the participant rolled from the posterior thigh most proximally, more distally to the ischial tuberosity, or to the bottom of the knee. For neurodynamic nerve gliding, it was a more hands-on technique where the examiner extends the knee to end range, then alternates ankle and neck position to slide the sciatic nerve through its pathway. The same total time and number of sets for both were used, which is what lets us attribute any difference in results to the technique itself, not just more stretching. This is the headline result. Neurodynamic nerve gliding improved end range stiffness, knee range of motion, and passive resistance torque. Foam rolling, unfortunately, did not move any of these. Both techniques improve the straight leg raise angle equally, so hip flexibility improves either way. This gap shows us specifically in knee extension, the position that puts the most load on the nerve, is most helped by neurodynamic nerve gliding, showing that values such as neurodynamic nerve gliding, increasing knee extension range of motion by 15%, and PRT by about 29%, which was considerably more than foam rolling. So, to discuss this, why did neurodynamic nerve gliding do more? This is likely because it directly targets nerve mobility and not just the muscle, looking at the sciatic nerve and stretching it in different ways to reduce nerve irritability. Foam rolling likely works by raising pain stretch tolerance, stimulating receptors in the fascia rather than truly changing the stiffness. So different stretches move the sciatic nerve in different directions. Hip flexion pulling it one way, knee extension with the hip flexed pulls it another, which may explain why the two tests didn't respond the same way to each technique, and why neurodynamic nerve gliding specifically improved knee extension range of motion. So, the clinical implications of this. The practical takeaway is that neurodynamic nerve gliding may be better as a warm-up choice before movements that need a lot of end range knee extension, specifically in soccer, kicking the ball, because when you follow through, you have that end range knee extension where the leg is in full extension, fully stretching the sciatic nerve. We can also see this in sprinting as well. Neurodynamic nerve gliding also seems to reduce stress on the nerve while still increasing mobility, which is a good combination for any injury prevention programming. So, again, this is a very simple implement for about 6 sets of 45 seconds, taking no longer than 5 minutes, and no equipment needed besides a partner or a therapist. While this data looks great, we have to think about some limitations and some limitations of the experiment. Some limitations worth flagging is that this was a small group of young, healthy male athletes. It did not look at any females nor previously injured athletes, so we can't assume these results generalize. They didn't directly image the nerve or the fascia sliding and didn't test strength or on-field performance. Rather, they tested biomechanical factors. The conclusion is that both techniques help hamstring flexibility right away, but neurodynamic nerve gliding has an edge for its movements that load the nerve, which is worth considering for adding to warm-up routines that may be very impactful for injury prevention. Here are my references. Thank you for listening. Any questions from anyone in the crowd?
Yes, thank you for that presentation. Does anyone have any questions, or Dr. Lopez, would you like to add anything?
Yeah, thank you so much, Chris. Obviously, hamstrings are very, very challenging. We've all heard, even when we see a soccer player twinge or a basketball player twinge, you got to remember the implications of what that is. It's long, protracted rehabilitation. If it's a tear or right, and it could be, as we discussed even earlier in previous lectures, the hamstring could yank or pull something, so it could be multiple degrees of injury in the muscle itself, fraying, injury, tear. But what happens, and this is really, Chris, did you find out what did they do, or what did they say when you tear the muscle? Did they kind of allude to the pathology of that, the pathophysiology of what occurs?
They unfortunately didn't really talk about the pathophysiology in the paper and
All right.
focused more
So
on the treatments.
what happens when let's say, what happens when you tear a muscle? Does anyone have an idea? Anyone want to take a stab at it?
I know that, I'm not sure if this is the answer you're looking for, but when you tear the muscle completely, certain
But
muscles
let's not get that far ahead. Right? Let's say you got you got a tear in the muscle. It doesn't have to be a big one. What occurs, do you think, Elon?
Weakness in the muscle.
What first occurs if you rip muscle? What am I looking for?
I'm not
So
completely sure.
okay, everyone's bumped into a table in some capacity. What do you see when after you've bumped into a table?
There's swelling and bruising.
Bruising. What's that from?
Fluid and blood trying to repair the muscle.
Blood. That's from the blood. Why does the black and blue hurt so much?
As the area is inflamed.
The iron, right? The release. So the release of the blood, and then the iron, right? That causes that whole black and blue, and then it turns yellow. And then if it's in an area high, then you'll see that the blood will go down to the ankle, or it goes down into the knee area. You'll see that the fascia will capture wherever the blood injury, resided. And if you have that really ugly yellow bruise all the way down at the knee, if you've torn anything in the groin, in the hamstring, you'll see in the back of the knee, because the knee fascia will capture that blood in there. So you get blood. What occurs after that? Does that blood really kind of leave? So it reverts to fibroblasts, and then it scars over. That's great if you're healing over a ligament or a tendon. Not so good with moving. Who knows about the anatomy of the muscle? We're talking about fast twitch, slow twitch. Then we're talking about the actual, what's the muscles made of?
Muscle fibers, you have myosin and actin.
So what happens is that you've disrupted the flow of them contracting, right? And releasing and contracting, yeah? Now, imagine fibroblasts freezing them. Now you've moved the apex of the muscle group and its strength, Elon, from wherever the center of the body of the muscle was to below that area of now scar tissue. Who saw Ted Lasso? Anyone see Ted Lasso? All right. What is the mean soccer player's biggest thing? What does he like to be left alone?
Ice bath?
Nope. You're getting close though, Brendan. He likes to get, you remember, he likes to be left alone when they knock out the kinks in his muscles. You remember? So what happens is that, particularly with this is why it's almost kind of weird, but they would have rather had a physiotherapist or a masseuse with the team earlier on than an athletic trainer or a doctor. They felt that the masseuse would be more impactful for the benefit of the sports and that, because they want to, massage out the kinks in the hamstrings, and you get these minor or micro tears if you're, running. If you're doing sporting activity, you end up with these little micro tears, and these little micro tears, the blood then becomes fibroblasts, and they then scar over, and you get these knots in your tissue, and they want to knock them out. And that's why the masseuse uses all those tools, or the physical therapist will come in and you'll work out the entire muscle group. It's quite painful. I could probably go for like 20 hours of that without a problem of how thick my muscles have become from the 30, 40 years of sport. My wife doesn't even want to touch me. Like, try to massage me, forget about it. It's like, no way. Go get a can of soup or something. That's how dense. But that's after many, many years of playing sports, activating the muscles, whether it was swimming, judo, rugby. The whole idea is that, excuse me, and that's probably, maybe because I didn't focus on one sport, and let alone, I'm not even talking about the 8 to 10 years of baseball. That's just part of the religion of Puerto Ricans, right? To make it the Bantam League, they demand that you even just show up at the high school tryouts. Like it's crazy. Baseball is like a whole nother culture in Dominican Republic and Puerto Rico. It's like a whole nother. It's like the way soccer is probably for Brazilians, right, Julia? Baseball is very, very, ingrained. So the whole idea is what I'm trying to tell you is that the muscles have these micro tears, micro injuries all the time. And we're not even talking about a major one, Elon, like you were alluding to. That's a whole nother bag. Then, because you have retraction, you have, you have to really kind of weave that muscle back into where it's supposed to go. And because of it, multiple insertions of the hamstring, right, comes down, around, and inserts on the lateral aspect of the knee. So what's kind of interesting is that your muscles give your knee more support than your ligaments really do. No way of really working them out per se, because at that point, at that finite end, they're more, tendon, Anyway, all right. On that note, very, very good. Thank you very much. Like I said, the pathophysiology of muscle tears is it's a whole science. Thank you for talking about the hamstrings. I think it's very interesting and very important area to understand. That and also calf strains. I think really, really challenging. Please go ahead. Next.
Okay. Our second intern to present is Hunter from Massachusetts. Hunter will be presenting on protein supplementation. Hunter, will you please share your screen?
Thank you, Elon, for the introduction, and I'm going to share my screen now. All right, perfect. Okay, so my article was the common questions and misconceptions about protein supplementation and what the scientific evidence really shows. It was by Jose Antonio, Cassandra Evans, Arnie A. Ferrando et al., and it was published in the Journal of International Society of Sports Nutrition in 2024. Okay, the introduction. Protein is a very well-researched macronutrient. However, there's still a lot of misconceptions in society. So this article wanted to answer common questions to help people make informed decisions about dietary choices. This article was a literature search of PubMed, and it aimed to answer 11 key questions. And the important terms to understand before going into this presentation are RDA, recommended daily allowance, EAA, which is essential amino acids, and MPS, which are muscle protein synthesis. The first question was whether protein is harmful to your kidneys. This stems from reports that consuming protein in increased amounts would prompt development of renal disease, which is due to increased glomerular pressure and hyperfiltration, and this leads to increased wear and tear of the kidney filtration, eventually leading to issues. However, there are multiple studies disproving this fact that renal impairment is a risk, and also Antonio and colleagues did tests with 4 to 5.5 greater than RDA diets with protein, and it showed no great effects on kidney markers. Next question is whether consuming excess protein increases fat mass. Body fat is a result of calories consumed. You may have heard of calories in and calories out, and the intake of extra calories over the daily amount that the body needs will lead to body fat. High protein diets during hypocaloric conditions, which means under the caloric needs, with high protein diets showed that they maintained lean body mass and increased loss of fat mass, and similar in hypercaloric conditions in which they ate over their dietary necessity in calories. In a study by Antonio et al., males and females did traditional bodybuilding programs. They saw increase in lean body mass, but the higher protein group compared to the control had greater reduction of fat. The next question was whether dietary protein could have a harmful effect on bone health. This comes from the acid ash hypothesis, in which high protein and grain diets lead to increased acidic diets, and calcium from the bones come into the bloodstream to neutralize it, increasing calcium levels in urine. And people thought that this would lead to osteoporosis. However, evidence found in high protein diets increase the amount of calcium digested and would offset this issue. And also bone tissue is 50% protein by weight and 33% protein by mass. So protein is actually very helpful for bone health. The next question was whether vegans and vegetarians consume enough protein to support training and adaptations. Plant-based proteins have 42% less essential amino acids than animal-based proteins, and they are also absorbed at lower rates. In addition, 53 to 75% more plant-based protein is needed to be consumed in order to obtain the recommended 2 grams of leucine or 6 grams of essential amino acids to optimize muscle protein synthesis. However, Hevia Lorraine et al. In a study with vegans consumed 1.6 grams per kilogram of body weight per day with and it matched the omnivores and had similar increase in whole body lean muscle mass and 1 rep maxes. So it is possible. However, vegans will have to adapt for their diets. So the next question was whether cheese or peanut butter are good protein sources. So the ISSN recommends about 20 to 40 grams of protein per meal to maximize MPS and athletic recovery. So here in this table, we see Skippy peanut butter, cheddar cheese, and uncooked but skinless chicken breast, all at 100 grams. And as you can see, while peanut butter and cheddar cheese have much greater calories for less protein, chicken breast has 32 grams of protein for only 158 calories, which means it's much better. It's a much better protein source, and peanut butter and cheddar shouldn't really be considered a primary protein source, while they can be supplemental. So, does consuming meat cause unfavorable health outcomes? This came from the idea that when cooking, heterocyclic aromatic amines and polycyclic aromatic hydrocarbons would produce and could lead to cancers in the lungs, esophagus, stomach, and colon. However, in a 2010 systematic review and meta-analysis of prospective cohort and case control studies, it found red meat consumption and white meat consumption were not significantly related to coronary heart disease. However, there were links found between processed meat specifically in colorectal cancer and lung cancer. So, unless it's processed meats, there's no real link. Another question was whether you need protein if you're not physically active or lead a sedentary lifestyle. Protein is always important as it has important roles in protein synthesis, cell signaling, satiety, thermogenesis, and glycemic regulation, which are processed in all human bodies. And Humayun et al. Suggested a range of 0.91 to 0.99 grams per kilogram per day, which is already above the recommended amount. And this was with high quality protein sources. So those who don't eat high quality protein sources might need to eat even more protein to hit their recommendations. The next question was whether, sorry. Okay. The next question was whether one needs protein supplements to meet the daily requirements of exercise-trained individuals. So for exercising populations, the recommendation is 1.4 to 2 grams per kilogram per day, and especially during caloric deficits, this needs to be increased so that way less lean mass is lost. And thus, protein powder provides protein with minimal calories, especially in these caloric deficits. And as you can see by this nutrition chart right here, while it may not be as good of a source as chicken breast as we saw earlier, compared to more fatty sources such as beef or peanut butter, it is much more calorically friendly, and is also much easier by drinking it than having a whole meal. So is there a limit to how much protein can be consumed in a single meal? So muscle protein turnover is dependent on EAAs and is stimulated by exercise. And this misconception came from the seminal studies of Moore and Woodard, who demonstrated max MPS response to 20 grams of protein. However, Trumlin et al. Found ingesting 100 grams of milk protein led to greater anabolic response than 25 grams, and this response was also prolonged over 12 hours. And there's also many other articles that show different time frames and different grams. So what are the limitations of the study? So there's a great variation in all these studies, and also with the language that they use, such as high protein, and sometimes in these studies they were not defined. In addition, it's not possible to identify causation because you can't really do randomized control trials with these to disprove these claims. In addition, because it's a literature search, there might be an inheritance of selection bias from the previous experiments. So what are the conclusions? Protein consumption is safe. There's no evidence that there's links to damage of kidneys, bones, and there's very little connection to cancer outside processed foods. High protein diets can promote fat loss and muscle gain, and results depend more on volume, quality, and caloric density than an anabolic window. In addition, certain groups need more protein than others, such as vegans and vegetarians, and protein supplements are a useful tool to supplement the protein intake for athletes. In addition, 20 to 30 grams each meal is enough, but there is data to support up to 100 grams that can elicit higher and more prolonged response. Finally, the application of RRIPG. Because we take care of so many rugby players, it's also very important for rugby players to understand their own nutrition because they need it to properly fuel themselves and be at their best performance, especially with protein to build muscle and skill that in such a high contact sport. This is my reference. I highly recommend looking at it because there's a lot of examples that I couldn't cover. Thank you for listening.
Thank you for that wonderful presentation. If there are any questions, or Dr. Lopez, if you'd like to add anything.
Great presentation. We can take it off of a point of view here. So great presentation. I think everyone's heard of the multiple high protein diet, and there's so many now. And the paleo, the carnivore, and the older Atkins, right? It was the zone, and there's some Dukan, I think, back in the day, if I'm saying it correctly. All these diets, they've all dabbled in this area. And so I guess, Hunter, did they specifically go over any of the diets? Did they say? No, this was just evaluating consumption of protein, correct?
So it wasn't really consumption of protein. It's mainly these ideas that people have in society that they are very much misleading. So I know in a lot of maybe bodybuilding or athletic groups, they have these misconceptions about maybe anabolic window or how much protein that you can consume in a single meal and how much can be absorbed. But this is trying to I guess fight these misconceptions and make sure that athletes and regular people understand their nutrition intake.
Yeah, listen, I think and again, I tried it all. I did I think I did the high protein water intake, creatinine when I tried to gain weight. My metabolism just wasn't meant to really kind of gain weight. I can't. My physiology just doesn't allow me to like gain that kind of weight that way. Even with muscle gains, it was really hard. I had to work out with like guys that were like ridiculously big to try to even just gain the muscle gains I gained to prevent myself from injuring myself. But again, I don't know if there really is. So in your conclusions, I guess let's just try to take this paper for what it's worth. People could choose to do a high protein diet without worry. Yes?
Yes.
And now the second question would be, do you recommend a high protein diet for long-term periods?
Well,
Or did they not go into that?
well, for this study, they didn't go into that, but from prior knowledge, I know it's also important to definitely balance out all your nutrition, especially with looking at like the carnivore diet. I know that because you're consuming only red meat, white meat, that kind of thing, you're definitely missing out on a lot of nutrients. You're missing out on vitamin C. You have different and also other nutrients that I'm probably forgetting that are in deficit because you're only looking at protein.
Yeah. So I guess it's always a fine line of how you balance your diet. I've always probably leaned on the high fiber, high protein diets all my life. I guess also coming from the Caribbean, we have a high protein diet. We do have rice, but we do consume quite a few lentils, quite a few legumes, different types of beans, and that's very, fibrous and very high in protein in our diet. But we also have embraced, because we're Puerto Rican, and we're not Europe per se, but we do have Mediterranean influence, so Mediterranean diet. A lot of olive oils and things like that, and then also very fibrous fruit diet. I'm not saying, it's the best, but, you kind of work with what you have. And I guess it's always challenging how you can kind of consume, your protein intake, whether eggs, whether it's, beans, legumes, or, maybe some other protein. A lot of people are very surprised on some fruits and vegetables that are high in protein, spinach and things like that. So you got to kind of figure that out, how to take in the consumption of the protein per se. I mean, I meant to say, sorry, but again, those are beans too. Anyway, the point is, what I'm trying to say is, it could work, but they didn't, I guess the question comes down is that I guess the jury's still out now with all these new trendy diets about what diet is best. But I don't think there's any diet per se best or worse. I think you just have to be everything in moderation.
Yeah. Also, I think something with the diets is that you have to be able to stick to them, especially with like carnivore diet or like keto, that kind of thing. Is when you're limiting yourself from having carbs or you limiting yourself from fats, you're going to have the imbalances build up, and then you're also going to have cravings that you can't ignore forever. So it's definitely personalized for everyone.
It's, and again, I'm not saying it's easy. I definitely have oatmeal maybe 4 times out of the week, 5 times out of the week, for breakfast. If I want to beef it up with protein or even just a little, something of that, whip an egg into it, or a hard boiled egg, just drop it into it. And I don't really pull out the egg, the yolk, leave it in there. I've been very fortunate. I do think, high fibrous diet is probably beneficial more so as well. And so I do salads maybe like 2 or 3 times a week. So for dinner, just like I'll put the protein on the salad, whether it's a Caesar salad with chicken or whether it's a quinoa, with tuna on the salad, or, even just a basic taco salad. I don't know. That's it worked for me. So like I said, it's I don't know if it works for everybody. And also, like I said, depends on the metabolism, how but like I said, it's getting me by. Okay. Thank you. Anyone have any questions, any comments, diet wise or anything like that? Protein, stuff like that? No? All right. Who do we have next?
Our third intern to present is Danielle from New York. Danielle will be presenting on multi-ingredient post-workout supplementation. Danielle, will you please share your screen?
Thank you, Elon. First and foremost, my name is Danielle Jefferson. I am a rising junior at Howard University, and today I'm going to be doing this presentation on the effect of a multi-ingredient post-workout supplement on body composition and muscle strength, a randomized control trial. Now, I will note that this was specifically catered towards aging populations, done by these authors and published in the Journal of Dietary Supplements in 2025. Okay. Ooh, okay. So first and foremost, post-workout nutrition is framed around the 3R paradigm. This is rehydration, refueling, and repair. However, this study specifically focuses on the repair component of this. In the early stages of creating the experiment, the authors looked into the background of the most common post-workout supplements and what ingredients they actually contain. There were a few that came up time and time again. These were creatine, beta-hydroxy beta-methyl butyrate, or otherwise known as HMB, and whey protein specifically, as it is a leucine-rich protein, and vitamin D3. You can see what each of these different components do here on my slides. However, while searching, the authors were ultimately able to identify that most of the evidence that had been out and been published regarding research for these ingredients was focused on studying them individually and their impact on the body individually. There's a lack of research on what happens when you actually combine them into one product, and especially in more aging populations. So that was really the focus of this study. So this study compares two main groups of supplements over a 6-week resistance training program. So it combines the actual dietary aspect where, participants are consuming either PWS, which is a multi-ingredient post-workout supplement that contains carbs, whey protein, creatine, HMB, and vitamin D3, all of those ingredients that we had listed prior. Whereas the other group, the control group, will be ingesting COM, which is isoenergetic carbohydrate only comparator. This essentially just means that 100% of the energy in this substance is derived from carbohydrates, even though they ultimately yield the same amount of caloric intake. Yeah. So these all in the study, they also measured body composition, muscle thickness, strength, and performance to get their results. Essentially creating the hypothesis that the full multi-ingredient formula would outperform carbs alone in these ways and through these tests. The population that they used was physically active individuals. These had to be individuals that, had been strength training for over 6 months prior. They all were around the age 51 to 52, although the requirement was that they had to be above 45. And there was an even split between men and women, with the women being both peri and postmenopausal. Okay, this is an actual chart from the article that kind of breaks down what is in the PWS supplement in opposition to the comparator. I want to just bring your attention at least up here, where the primary difference is that you can see the comparator lacks many amino acids, which are super, super important to our body's composition. And we will see how they get more important when you get older as well. But you can see even at the top that the energy value or ultimate calorie yield for each of the supplements was very, very close, with the PWS one coming in at 204 and the comparator coming in at 203. So in terms of the methods and designs of the study, it was a double-blind, randomized, and controlled parallel group trial. There were 22 individuals that were originally recruited, though only 20 of them ultimately went through the entire study, meaning that 10 individuals consumed the PWS throughout the study and 10 had the comparator. As I mentioned prior, everyone's age was between 51 and 52, and there were some exclusions in terms of people who could be eligible to participate. Again, they had to be pretty sedentary, not have any chronic diseases or any interfering medications or supplements that would ultimately, skew the results of the trial. So in terms of the intervention and supplement training, here's exactly what each group drank. They did this mixed in about 400 milliliters of water right after every single workout. So the dosing was 60 grams, again, right through every workout. This ultimately led to 18 doses total throughout the 6 weeks. This is what the PWS formula yielded just from the chart, as well as the comparator. And the full body circuit workout that they were to perform each time, which was 3 times a week, consisted of step ups, bench press, back squat, upright row, deadlift, lunges, shoulder press, and bicep curls. They were training for hypertrophy, targeting this with the weight being at 70 to 75% of their 1 rep max, basically the highest, which is basically the highest weight that one could lift or one could yield for 1 rep. These were the ways that they actually measured their outcomes. They did this through body composition, specifically a bod pod, also known as air displacement of plethysmography. This measures waist and hip circumference, which estimates body fat as well as lean mass by measuring how much air is around your actual body when you're in this sealed chamber that is considered the bod pod. When it came to muscle architecture, muscle thickness was measured using ultrasound imaging of the vastus lateralis, which is in your quad and elbow flexors. In terms of power and strength, this was measured using counter movement jumping on a force platform and a seated ball chest throw, which was also directed at a force platform. In terms of endurance, progressive cycling was used to test for exhaustion and your VO2 max peak, as well as the fat max. For those who don't know, fat max is the exercise intensity at which the body burns its highest, or burns fat at its highest rate. And finally, with the diet tracking, in addition to consuming the post-workout supplements or the competitor, the individuals and participants of the study were instructed to log 3-day food logs through the MyFitnessPal app. They collected this at 3 different checkpoints throughout the experiment just to verify that there were no deviations in participants' habitual intake prior to the actual 6 weeks in which the trial was conducted. The participants were all monitored just to make sure that there were no deviations during the actual time of the trial. So that's kind of how they found the habitual intake measurement and compared that. Now we get into the results. So this is where we see that the PWS significantly started separating itself from the comparator. First and foremost, with the fat-free mass, this is going to be like lean tissue. And this increased by roughly 1.34 to roughly 1.2 kilograms with the PWS, as well as having a p-value of 0.003, which was super, super wonderful for this experiment, meaning that that value is statistically significant and meaning that it's a strong result. For the fat-free mass, this actually dropped by 1.09, give or take 0.7 kg of deviation in the PWS trial or in the PWS participants with a p-value of less than 0.001, which is again amazing and showing that the PWS showed a significant change. When we get to the waist circumference, it shrank by 2.5 centimeters in the PWS versus only 0.4 in the COM measurements. And between the group difference, what the p-value was 0.02 with an effect size for Cohen's D's measure of 1.19, which again, a really good value. Getting to the waist to hip ratio, this also improved significantly in the PWS group as it yielded a p-value of 0.007. And finally, body mass was the one factor that had the little to no group differences in their total body mass change, which makes sense, honestly, given that the PWS participants were simultaneously losing fat and gaining muscle at the same time. So any number on the scale would have likely seen no difference regardless. All right, when it gets to the muscle and performance aspects of the results from this, first and foremost with the hypertrophy, the vastus lateralis and elbow flexor thickness increased significantly and similarly in both groups. This could also have been just from the resistance training itself, not the supplement, so that's an important thing to note. The vertical jump improved in both groups, but PWS group did improve significantly more. The seated throw ball or the seated ball machine also improved similarly in both groups. The training volume increased similarly for both groups, and the endurance improved comparably with no adverse effects reported from either of the groups. Now, there are a couple parts of this that I just did want to discuss and bring up as I was contemplating them while reading. First and foremost is why did the PWS ultimately improve body composition? This actually really relates to the previous presentation that Hunter gave us, and it really taps into the importance of the type of proteins that you're consuming. Added whey protein obviously likely boosted the satiety and the thermogenesis and the fat oxidation, which would lead to an explanation of the PWS group's increased fat loss. When it comes to an analysis of the participants' diets, both of them actually fell below the recommended protein intake for their habitual intake, which could have amplified the added protein benefits of PWS, but that could also just be reflective of a need for an aging population to be consuming more protein in general. Now, how much was hypertrophy truly affected? Again, similar muscle thickness gains could have just suggested that it could have just been due to the resistance training itself rather than the actual supplements. And lastly, I at least had some concerns about inadequate dosage levels and too limited of a duration for the trial. Oftentimes, those who work out will also know that, 6 weeks isn't the longest time, especially to be seeing results in separate supplements that, they affect every individual differently. Everyone's going to respond to them differently. And if you're only taking them 3 times a week, that might be something to consider when looking at these results. So these are some limitations that came up during this trial. First off, all of the food intakes reported on MyFitnessPal were self-reported. Obviously that can lead to some issues as you are trusting to participants to be self-reporting. With that, there were also non-individualized dosing per body mass. Again, everyone's body is different, and therefore, with the different shapes, sizes, ethnicities, races, etc., it could have led to some differences in how people were, really ingesting and metabolizing and how the different supplements affected each person's body individually. And the fact that, it wasn't calculated for their body mass could have also contributed to the results. With that, I also, in the beginning, I know I briefly mentioned that it was peri and postmenopausal women that were included in this study, but there was no hormonal or menopause staging blood work that was performed prior, which can also have a big impact in the many things that were calculated and measured in this study. And then finally, just the fact that it had only 6 weeks. The biggest takeaway for this is that post-workout protein, creatine, HMB, and vitamin D are all, specifically D3, are all meaningful in aiding body composition goals, especially in aging and active adults, even in the short term. However, it's really just important to take the results from this literature and apply them situationally, depending on, if you are an aging individual who is considering strength training, taking in more protein, things of that nature. And I also wanted to just connect it to RRIPG here for a second. As you know, we do treat athletes first and foremost. They are our main concern. The findings of this study could be helpful for us as we are looking at potentially aging athletes and more of an aging population, as we are aware of how the body changes with age. Yes, so this is my reference. Definitely recommend the article for anyone that wants to read more. And thank you so much for listening. Happy to take any questions.
Yes, thank you, Danielle, for that interesting presentation. If there are any questions, or Dr. Lopez, if you'd like to add anything, please go ahead.
I think thanks for bringing up the limitations. So did they time them on when they ate, or
Sorry, Doctor.
when did they time them on the time like when they consume the food, or did they regulate that factor at all? So like, did they eat just before sleeping, or did they regulate because obviously you take a nap right after eating, whatever.
They only regulated it in terms of the window from when the workouts were completed. So participants were not allowed to eat 3 hours. I believe it was either 2 hours prior and 3 hours after, or 3 hours prior and 2 hours after, but only centering around the workout. There was no restrictions in terms of when participants were able to eat for the rest of the days, as well as the days that they did not work out.
I apologize. So sorry. So they didn't regulate their sleep patterns, or when and if they could have taken a nap, and so therefore they could have rested post recovery, but they didn't want them to do it was 3 hours post recovery or post. So let me clarify.
Yeah,
so they exercised, and then they took the intake of the post workout protein, creatinine, whatever, and then they waited 3 hours before sleeping?
Correct. They were not. I'm sorry, wait. I was under the impression that you were asking about eating and consuming meals, not sleeping. This study did not regulate sleeping whatsoever. They did not monitor their sleep schedule or sleep habits whatsoever. They only monitored the food intake. So the food intake, if they were going to consume any sort of meal, was restricted to either 3 hours pre-workout and 2 hours post-workout. That was the only regulation. My
So they
apologies.
had to make sure they consumed it within that window.
Correct.
So did they, in the study, did they talk about like how fast? So did they discuss how fast the metabolism of these people that they chose? Obviously, before we get into that, did they regulate what type of protein, or they just regulated the grams of protein?
They did not regulate either in terms of the participants' intake on any day. They only regulated when, like, the hours that they were able to have meals on the days that they performed the workout, and they monitored the participants' diets to make sure that they weren't doing anything abnormal to however their measurements came in the 2-week training period prior to the 6-week trial period kind of starting, if that makes sense.
All right. Yeah, a lot of variables there. I do apologize. There could be a lot of variables post, right after working out. Sometimes you just want to crash, and maybe they didn't eat within the 2-hour window, or what did they say? 2 hours, 3 hours before, 2 hours after, right?
They were not allowed to eat within the 3 hour before, 2 hour after window. They were given the protein shake right after the workout concluded. The protein shake containing either the COM or the PWS supplement, just for clarification.
Yeah, that's okay. I'm just trying to figure out, wow. Yeah, that's probably why they only had like 20 people. Who would want to like limit themselves? Well, how's this? If you have someone who's working out, I don't think they're gonna wait 2 hours. They're gonna drink the protein supplement, and I'm ravished. Like they're gonna have to really regiment themselves time wise. Where did this study occur? In what country?
This study occurred in London. It was the school, what's the university name? It occurred in London. I know that. I believe it was Cambridge, a school in Cambridge. I can pull up the exact school.
No,
Just
that's all right. No, I was just wondering what country. Interesting. Very interesting. No, that's a good study. And like I said, the takeaway, you honed that in home, said, the takeaway was, obviously post-workout protein and supplements work for recovery, fat burning, lean mass, endurance. Am I correct? Like the endurance as well, right? The VO2 max improve, or it didn't affect per se, or it did improve the VO2 max.
Well, what was interesting is that it didn't have much of a difference of the effects of the comparator because the comparator was entirely derived its energy from carbohydrates, which is interesting when it gets to something like a VO2 max or an endurance training workout versus something like your actual strength when you're measuring, outputs like that. But yes, I would agree that that is the major takeaway for me. Another thing that at least I was thinking of is, in terms of educating athletes when they are, especially in that transitory period that you and Natalia were referring to. I mean, a little different just because I'm thinking of ones that are older and on the verge of retiring, but just that transition when it gets to nutrition and it comes to fueling their bodies properly. Especially to preserve lean mass and overall health.
Great. No, thank you so much. That was a good talk. Good presentation.
That will conclude week 7 of the RISE Institute and Rugby Research and Injury Prevention Group Sports Science Series. Thank you all for attending.